Of course, this issue unfolds differently from person to person. So we'd like to hear the perspective from a family doctor who's in Toronto. Dr. Warda Iqbal works at Sherborne Health Centre in downtown Toronto. And Dr. Iqbal, what kind of conversations are you having with patients now on vaccine hesitancy?
That's right. So, Ian, what I would say is that a lot of people that I'm meeting, I'm having conversations about how can we instill confidence in these vaccines. I'm finding that a lot of people are still not very confident, and maybe they don't trust the vaccines that well. And really, that's what we're trying to focus on. We're trying to understand from people what kind of belief systems are they coming from? What kind of experiences have they had with the healthcare system? And what really constitutes their worries? And that's kind of where I come in. We're trying to have conversations with people in a judgment-free and in a safe environment, so people are able to express their concerns and really able to understand their experiences and respect their experiences before we go on to where we actually tell them, hey, maybe it's time to get the vaccine.
So obviously in the recounting, we won't be able to tell who you're talking about, so confidentiality will be protected. But give me an example of a conversation you've had with somebody over this and how you got from where they were at the beginning of the series of conversations to maybe changing their mind or thinking about that.
Yeah, so actually the first example that comes to mind is this past Friday, we actually did a pop-up clinic right at the intersection of Wellesley and Parliament in Toronto. And we had a person come in, a young individual who's had their first vaccine back in May and is now quite worried about the second vaccine. Actually, this is the second time I've had this conversation in the last 2 weeks with the same person. Her worries are really about myocarditis and pericarditis when it comes to young people, and she has a complicated medical history, and she's quite anxious, rightfully so, what this could mean for her. Usually what we do in that situation, I take the person off to the side. I tell her there's no pressure from us. Let's talk about what you've heard and what your worries are. Slowly, we are having a lot of conversations, usually last about almost half an hour each time. We're not quite there yet where she's made up her mind, but just seeing us around and having that conversation is really helping her actually get closer to the point where she might actually consider the second dose.
What about, though, when somebody comes in to your office and they believe strongly in something which is pretty clearly factually wrong about the vaccine? How do you deal with that?
Yeah, so sometimes that does happen. And really what I like to focus on is that if we start off the conversation right off the bat and we tell them, hey, that's not right or that's wrong, I think it does create a hostile environment. And that's really what we're trying to avoid. What I like to do is I like to listen to them, understand where they're getting their facts from and why they really believe in that before I provide them with the alternative. It creates a much better environment and it really opens up the conversation so that we can continue that later on so we can get to the confidence in the vaccines.
All right, Dr. Iqbal, thank you very much for speaking with us.
Thank you.